Well, first of all, just thank you so much to Research America for recognizing the members of the task force, the people of the state of Michigan, for really stepping up and doing the right thing during this once in a lifetime public health crisis.
Today, I signed an executive order officially creating the Michigan Coronavirus Task Force on Racial Disparities within the Department of Health and Human Services. The Lieutenant Governor, Garlin Gilchrist, will chair this task force, and Dr. Janae Caldoun will be serving on it.
Every state department and agency is represented on the task force. And then for our members from outside of state government, we have 24 of the brightest minds across the state when it comes to public health and epidemiology, faith leaders, labor leaders, young people, young professionals, parents, community activists, health providers. So all of those diverse perspectives enabled us to, I think, have a more robust set of responses. And that included everything from, you know, sending out 6 million free masks because masks were the most effective way and simplest way to slow the spread of the virus, to investing in community organizations that were doing innovative programming around addressing the social determinants of health. And that systemic approach really came from the diversity and the breadth of the task force members itself. We wanted to try to have, again, a broad range of people with a range of expertise and experiences and networks so that we could reach into communities all across our state, recognizing that racial disparities present themselves in different ways in different parts of our state, and that we needed to have interventions that were responsive to that. I live in Detroit. Detroit's the Motor City. We invented cars. So naturally, we invented drive-through COVID-19 testing because, of course, you should be able to do that in your car. We think you can do anything in your car. But in the city of Detroit, 30% or more people in the city do not have access to their own car and are reliant on public transportation. So what we then took the next step and said, okay, well, we need to bring testing to people. And so we worked in partnership with Ford Motor Company and Access Community Health out of Dearborn, Michigan, and Wayne State University to develop these specially outfitted mobile testing vans that would literally drive testing to a community, to a neighborhood, a community center, a homeless shelter, a park, a church, literally driving it to people who otherwise may not have been able to access testing. One of the first testing and isolation sites that I visited was one for police officers and firefighters in Dearborn, Michigan. So we had specific infrastructure that was designed to be able to support the care, testing, and treatment of first responders, recognizing how important they are to our cities and our communities' lifeblood. I talked about how early in the pandemic, Black Michigan represented 41% of the people who passed away from COVID-19. In the last 3 months of 2020, that number was down to less than 10%, which means that essentially Black folks went from being very, very overrepresented in the people who passed away to being underrepresented. And that is literally what it means to flatten the disparity. What the most important factor was is that we chose to focus on this. The state of Michigan decided that the experience of communities of color was critical to the success of our state during this pandemic, and that we needed to put attention and resources on addressing that problem. And with those attention and resources came results. So I would encourage anyone, medical professional or decision maker, what you pay attention to, you can make progress on.